This is a plain CT scan orbit of a 63 years old male patient. He has got uncontrolled diabetes mellitus. He presented with painful proptosis on right side. There was conjunctivitis, purulent discharge, corneal ulcers and keratitis. No inflammatory changes are present in the soft tissues in right cheek. Density of subcutaneous fat is increased, muscles are thickened. Please observe, this is the right maxillary sinus, which is opacified, suggestive of right maxillary sinusitis. Now this is the left nasolacrimal duct, which contains air, while this is the right nasolacrimal duct, which contains soft tissue density shadows. Now as I scroll upwards, this is the site of nasolacrimal sac. This is inflamed, suggestive of dacryocystitis. There is proptosis on right side. Right eyeball is displaced anteriorly for approximately 2.7 centimeters from the interzygomatic line. Density of retrobulbar fat is increased. All the extraocular muscles are thickened. Now there is right maxillary sinusitis, right ethmoidal sinusitis, and right frontal sinusitis. Right ethmoidal sinusitis may result in right orbital cellulitis, but in this particular case it does not appear to be because of the right ethmoidal sinusitis, because in cases where right ethmoidal sinus results in orbital cellulitis, usually the findings are more severe in the middle part of the orbit. Usually there is a subperiosteal abscess and enlargement of the medial rectus muscle is more severe, while in this particular case the findings are generalized. Now this is the right lacrimal gland, which is enlarged. This is suggestive of the dacryoadenitis here. This is the coronal scan. Please observe proptosis. Density of peribulbar fat is increased. Sizes of all of the extraocular muscles on right side are increased. These are suggestive of the myositis along with the orbital cellulitis. Now please observe, this is the right lacrimal gland. This is enlarged as compared to that of left one, suggestive of dacryoadenitis. Now this is the right lacrimal sac, while this is the place of the left lacrimal sac. This is also enlarged. This is suggestive of the dacryocystitis. This is the nasolacrimal duct here, this one here. Soft tissue density shadows are present inside it. So it's a case of right orbital cellulitis, myositis, which has resulted in painful proptosis and diplopia on right side. There is associated conjunctivitis, keratitis and the corneal ulcers. And I will repeat again that this does not appear to be because of the right ethmoidal sinusitis, because if it was because of the right ethmoidal sinusitis, there should have been abscess formation or soft tissue density thickenings in the middle part of the right orbit, while in this particular case the findings are generalized and there is no isolated thickening of the medial rectus muscle, which is usually associated with the right ethmoidal sinusitis in cases where it is responsible for the right orbital cellulitis.